Hi everyone, this is Dr. Stefan. Welcome back to interstitiallungdisease.info. In this episode, I'd like to tell you a little bit about this multidisciplinary team discussion, or MDT, or sometimes MDD, multidisciplinary discussion. This is a very, very key thing that we have to consider when we diagnose interstitial lung diseases. And basically the gold standard for making a diagnosis, a certain diagnosis in this field of interstitial lung diseases, is this multidisciplinary team discussion. What happens during this discussion can vary from place to place, but it's basically a discussion forum where your clinician, maybe your doctor, maybe nurses from the team, a pharmacist, a radiologist, a pathologist, other specialists potentially may join in to have a discussion about the case, to try to come up with a consensus diagnosis and maybe a consensus regarding treatment options, whether any further tests are necessary to diagnose your interstitial lung disease more precisely. And obviously, this video doesn't aim to be a complete discussion about the multidisciplinary team discussion, which is very, very complex actually. It's a huge topic. There's lots of progress that's being made, especially with regards to virtual multidisciplinary team discussions, because you can imagine if an ILD unit has to see hundreds of cases and each case needs to be discussed in most situations, especially when we're considering treatments, it can lead to a huge backlog because we need to get all these clinicians involved in the same room, or maybe, remotely dialing into a meeting to discuss the cases, weigh in their opinions and come up with a consensus diagnosis regarding diagnosis, regarding the disease progression, how quickly the fibrosis is getting worse, things like that. So treatment options, all of these things need to be discussed. You can imagine it takes maybe 5, 10, 15 minutes per case. So you can imagine this can lead to huge delays. And the problem that I see from the clinician side of things as a doctor is that sometimes patients need to wait for quite a long time for an outcome, especially when a multidisciplinary discussion is required. And this can sometimes have the appearance that we are delaying treatment. But to be honest, depending on local arrangements, this can happen sooner or faster or slower. But sometimes it's important to have this consensus, even if it takes a little bit longer, because there's a higher likelihood that that patient will be on the right treatment for them, or they will have the right investigations for them if we need further discussion. The problem we have in the field of interstitial lung diseases is that all cases are very, very nuanced. So on a case-by-case basis, we need to make certain decisions. We have guidelines in the field, but you can imagine, because it's a field in which many diagnoses that we make regarding the lungs are done by excluding certain causes. So for example, when we diagnose idiopathic pulmonary fibrosis, that's a condition in which we have scarring of the lungs that's progressive, but we don't have a known cause. So you can imagine, we can do some tests, but at the end of the day, we may be put in a position where we run out of tests to do, and we still cannot find the cause. So then we need to make a judgment that this condition we will call idiopathic pulmonary fibrosis, or IPF. And there are other situations like this in the field of interstitial lung diseases. So being a nuanced field, we need to sometimes go through the process, even though it may take a few weeks, few months to get the right treatment. And that is something that's difficult, and that leads to another discussion. What is the best treatment option? Do we then think about research projects, trials, because we have imperfect treatments in this field? Many of the treatments that we use for interstitial lung diseases are there to stabilize the condition or to slow down the progression, the decline. There are only a few situations in which we can reverse what's going on, especially if there's a lot of inflammation on the lungs. But as you can see, this requires a discussion. This is why we get the radiologist involved in the discussion, because they can clarify, for example, things related to radiological patterns. What does the scarring look like? Does it fit with any other diagnoses they've seen in the past? And having an expert opinion from an expert radiologist is really important. Sometimes there can be difficulties with agreeing what pattern we are seeing, because different people have had different experiences with different cases. So this is why bringing the cases for discussion in an open forum where everyone can weigh in their opinions sometimes can be really, really helpful. So what happens during this MDT discussion? Just to give you a little idea. So normally, I think in most centers around the world, this can vary, of course, and the arrangements can be different, but maybe we will discuss between 10, 15 to 20 cases in one session. We all sit down together, we look at the radiology, at the scans on a computer screen or on a projector. Someone will present details related to the case, so the clinical presentation, the history, age of the patient, have they smoked, have they been exposed to different things, have they had an autoimmune screen, so testing for rheumatological disease, for example, done, has that been negative or positive. We may have a rheumatologist present in situations when there are features that suggest that there is an autoimmune or an immunological disease causing the ILD, so they can provide an opinion and we can try to decide whether that plays a role in the imaging that we're seeing. Is that the trigger for the condition? That could be there. Sometimes when we are considering doing more invasive procedures to try to diagnose the condition better, for example, when we're considering a lung biopsy, we may have a thoracic surgeon present, so they may weigh in whether the risks of the biopsy outweigh the benefits. Do we really need to do that biopsy, or can we make a fairly confident diagnosis of a certain condition? We may also have, in recent years, there's been a push to try to get other specialists involved. There is a drive towards genetic testing, genomic testing in the field of interstitial lung diseases, because there can be family aggregation. So you may have a parent, a brother, a sister with a similar condition. So then we may consider doing genetic tests. If a certain variant is found in the genes that may be predisposing members of that family to having these conditions, then we need to discuss that maybe with the genetician, who will advise on the risks and further testing that may be required for other family members, what type of screening we may do in these family members. So there's a lot of nuances in the field of ILD. So this is why we need the multidisciplinary team discussion. Now, another thing that's useful to mention here is that it is a great forum for training. And you may think that maybe you just want an outcome for your case, but it's really important to train other clinicians in the field of ILD to raise awareness, because it's a very small field around the world. There may be hundreds of people around the world who do this sort of job, and it's important to get more people involved, because a lot of people in medicine also don't understand how interstitial lung diseases are diagnosed. And it's really important to try to raise awareness because basically if we diagnose these conditions earlier, and this means earlier referrals from certain specialists who see these cases in the community, for example. It could be family doctors, it could be general pulmonologists who see cases of lung fibrosis. If these cases are referred early to a specialist center, there may be an option for better treatments. Because as I said before, we are looking at treatments that stabilize the condition, slow down the progression at this stage. Maybe in the future we'll have better treatment options, but at this stage, this is what we've got. So teaching is really important. Raising awareness is really, really important. And there is also a move towards doing these virtually, especially during the time of the pandemic. There's been a huge slowdown in how quickly we can process cases with interstitial lung diseases, how quickly we can get them through the clinic, being seen, being discussed at the multidisciplinary team discussion, or the MDT, and then being started on treatment. So that process has been delayed by the COVID pandemic because of limited slots, limited availability of clinicians, sickness, etc. So we are moving more towards doing these virtually, where people dial in during, in a Teams or Zoom meeting, and then we can have a discussion about the case and try to do that. That opens up a lot of possibilities, because we may come to a point where patients may not need to travel very far to get a specialist opinion. And that would be fantastic, especially if you're considering developing countries where you may not have access to specialist radiologists with the expertise in interstitial lung diseases, specialist pathologists, etc. So we may be able to collate all the information, have a discussion, feed back the outcome to someone in maybe not the same country. So this is great. I think it's a move towards getting something positive out of this bad time during the pandemic. And I would end this video by saying that if you are a patient who suffers with ILD, or you know someone who suffers with interstitial lung diseases, I would really ask that you talk to others about it, because we need to raise more awareness so that people notice that these conditions exist, because unfortunately it's a very small field. We are always looking for people to join our ranks, let's say, to try to fight these type of conditions, and we need patient advocacy in order to make the politicians and funders aware that these conditions exist, in order to receive the adequate funding, especially in places where maybe there's very limited awareness in countries around the world where, people do not talk about pulmonary fibrosis, or they think that it's always just a static thing. It's a result of, tuberculosis or whatever, or working in a mine, and no one really cares much more than that. So I would really ask that if you are a patient, please talk to others about this condition, try to join support groups. There's strength in numbers, and then this will lead down the line to better treatments, earlier diagnosis, better outcomes for patients. Thank you very much for watching, and if you have further questions, do leave them in the comment section below. I'll see you in future videos or episodes. All the best and good health.